Hello, my name is Christy Biddleston. Thank you so much for sharing your time with me. I hope that you will find the content here helpful. If you like what you see, I hope you'll consider liking this video and subscribing to my feed for future content. Today, I will be discussing the changes that have come about for vaccine guidance and how it will affect North Carolina residents. The sources for this information will be available in the description of this video. If you are planning to get vaccines for yourself or your children this year, chances are you have run into some confusion. Since the confirmation of Robert F. Kennedy Jr. as Secretary of Health and Human Services, issues related to vaccines overall have been met with more questions than informed and medically sound answers. Because I have been hearing so much confusion regarding vaccinations this year, I did some research to find out exactly what the new guidelines are and what North Carolina residents need to do in order to receive vaccinations. Regarding COVID-19 vaccines, Secretary Kennedy rescinded the emergency use authorization for COVID vaccines in an effort to, in his words, end COVID vaccine mandates and end the emergency. Rescinding this emergency use authorization happened before the CDC's Advisory Committee on Immunization Practices, or ACIP, had developed any new guidelines for the vaccines. This created a huge problem for North Carolina healthcare providers because by law, pharmacists have to follow advisory committee guidelines that were non existent when Secretary Kennedy made the announcement that he had rescinded this emergency use authorization. Since pharmacists no longer had that authorization, people who did not meet FDA criteria were faced with having to justify their need for a vaccination by providing a prescription, and even with that, the lack of authorization could have led to some insurers not covering the cost for the patient. And on top of that, healthcare providers had to either phone in a prescription or arrange office visits for prescriptions when they had previously been readily available and accessible for North Carolinians. This led to gridlock and frustration for pharmacists and other healthcare providers who communicated their concerns to the state health department and pharmacy board. In an effort to restore access to the vaccine, the North Carolina State Health Director, Dr. Larry Greenblatt, issued a standing order on September 12th that acted as a statewide prescription for anyone 65 and older and adults over 18 with high risk medical conditions in order to receive the COVID vaccine. On October 13th, that standing order was rescinded because formal guidelines had been established by the ACIP, and the changes in the federal guidelines regarding who could get vaccinated, what would be needed to get the vaccine, were also available. Fortunately, the new guidelines do not require a prescription for the vaccines. The prescription requirement had actually been proposed to the advisory committee, but thankfully the proposal was defeated by a narrow margin in September. According to the new ACIP guidelines, adult and child immunization schedules have been updated to include individual based decision making to COVID vaccines, also known as informed consent. So, although a prescription is not required, patients are required to discuss benefits and risks with a clinician so that they can provide consent before they are allowed to receive the vaccine. The ACIP also recommended that toddlers not receive the varicella or chickenpox vaccine, along with the measles, mumps, and rubella vaccination. Instead, recommending that children receive the varicella vaccine as a standalone immunization. On October 6th, the CDC Advisory Committee released this new recommendation, citing studies that indicate a slight increase in risk of fever or febrile seizures in children from 12 to 23 months old. And this risk is for 7 to 10 days after vaccination with the combination measles, mumps, rubella, and varicella vaccine. The compilation by the ACIP also stated that there is, quote, no, end quote, risk of febrile seizures if these vaccinations are given between 4 to 6 years of age. North Carolina Health News published an article where Jay Campbell, Executive Director of the North Carolina Board of Pharmacy, explained what the rules are if you plan to get vaccinated at a pharmacy in North Carolina. For any adult 18 and older, you can get a vaccine with a prescription. Anyone without a prescription can get the vaccine after having a conversation about the pros and cons of vaccination with the pharmacist. Quote, the CDC says that shared clinical decision making, Campbell said. All that really means is the pharmacist and the patient should have a discussion about the COVID vaccine, and then the patient makes the decision, end quote. Anyone ages 7 to 18 can also come into a pharmacy and obtain a vaccine without a prescription with parental or guardian consent and the shared decision making with a pharmacist. Parents or caregivers of children younger than 7 should contact their healthcare provider, a local clinic, or health department to find out if they are offering COVID vaccines according to the State Department of Health and Human Services. Quote, our goal is to improve access and reduce barriers to getting and staying healthy, and vaccines remain the best way to protect yourselves, loved ones, and your community, said Devdutta Sangbai, who is the DHHS secretary. She continues, the COVID-19 vaccine is one of the most effective means available to prevent serious illness, hospitalization, and death this respiratory season. We are grateful that North Carolinians who choose to receive the vaccine have an easily accessible path forward to do so, end quote. So thank you again for sharing your time with me. You can find a transcript of this podcast on my Substack, and that will also be linked in the description of this video. Information from the North Carolina Health News is offered through a Creative Commons license. Until the next podcast, I wish you all the best.